big problem with managing back pain is that there are lots of really unhelpful myths out there. So we're going to quickly bust some myths right now. So I'm here with Rebecca McCulloch, who's a specialist in musculoskeletal issues, and physiotherapist Marco Peluso. So let's get started. I love a good myth-busting session. So the first one is, rest isn't actually best if you're suffering from back pain. We'll pause for a second for the people playing along, and that question goes to Marco.
Correct. So initially, if you have acute pain or an acute injury, then rest is good for a few days to let natural tissue healing occur. But if we stay inactive for too long, we can develop muscle spasms. Muscles can actually get weaker if we revert to what we know as bed rest. So we want to stay moving as much as we can. And the old saying, movement is medicine. It gets your muscles acting, contracting, relaxing, and preventing pain.
And just to add to that, in our research, 50% of people say that exercise helps them manage their pain. So that absolutely backs you up in real life as well with real life people. So thank you for that one. The next one, this one's for Rebecca. A neck or a back brace is a good choice if you're in pain. What do you think at home? Do you think it's true or false? Rebecca?
Definitely a false for that one. I think back in the day, back in the 80s, I think people did think that braces were the right thing to use. So you'd see people with whiplashes and these big collars around the neck. But all it does is it actually exacerbates things because you're not moving, so everything stiffens up. And as Marco's just said, movement is always medicine. So yeah, definitely a false for that one.
Okay, and I think it's really good that we're highlighting that, because when you have pain, your brain, you're trying to protect your body, aren't you? And pain makes you think danger, something's wrong, and you have that fear of movement making it worse. But it's really important that people are reassured that just gently moving, keeping the muscles active is actually a good thing to do. And if you need to take some painkillers to be able to move around a bit, that's fine as well.
Definitely.
Okay then, next question. You don't need a scan to properly diagnose a back pain problem. What do you think at home? You don't need a scan. Is that true or false? Rebecca?
That is very much true. I think subject to contrary belief, I think a lot of people think that they need a scan to tell them what is actually going on with the back. But I always explain there's not a big white arrow on an MRI scan telling you where the problem is. So there's a lot of information that an MRI scan doesn't tell us in terms of movement, stiffness, weakness in the area. So it's just one part of the picture, and you definitely don't need a scan to tell you what's going on with your back.
But despite that, do you find often your patients are asking you for a scan?
Yes, every person pretty much. Again, I think it's just that misconception that a scan will tell you what's wrong. The only time that I would recommend a scan for someone is if, well, first of all, if there's something suggesting there's something wrong, serious going on with their back. But sometimes people have this very deep-rooted fear that there is something underlying with the back, and that can actually prevent them from their recovery. So sometimes just from a reassurance point of view, it can be helpful. But again, it is just one part of the picture.
And I know something I've learned, Marco, from my own experience, is that you can have, in some cases, lots of things going on an MRI, but a person's absolutely fine. And then you might have an MRI that's pristine and the person's got loads of issues with their back. So often there's no correlation, is there?
Absolutely. And if you're in clinic, you have to look for that correlation on the scan and to the symptom presentation. Okay
then, next one, good one for you, Marco. Lower back pain is caused by having a weak core. Have you heard that before? Do you think that's true or false? Marco?
So this is false. So people who have back pain actually have quite a strong active core because it's protecting your body from moving in different ways. So the muscles are very protective and contracted. And what we want to do is teach those muscles to relax, to improve the movement, again, so those muscles can contract and relax in their normal designed form and prevent any other muscle spasm around the pelvis or the low back.
I think we're often told, especially if we have back issues, to do things like Pilates because it strengthens the core. So is that still right, or is that
Absolutely,
not right?
It's important to have a strong core, but we don't need to focus on a single muscle group. We have to look at the whole muscles, all of the muscles that support the spine, and the core is an important part, but a weak core does not correlate to back pain.
Okay, really good to know. The next one, once you've hurt your back, it will always be a problem. What do we think? True or false? What do you think, Rebecca?
Definitely a false on that one as well. Again, I think people like that quick fix, but we have to look at the long-term picture as well. So we always give the right advice on exercises, movement, long-term management. And if people stick to that, then certainly they can get on top and manage their back pain and not necessarily have any further problems. When it becomes recurrent, it's generally when people ignore all that advice and don't do all the things to help themselves, and then you are going to be at more risk of having further problems.
I know I've seen that so many times with my patients, that they sort of get on top of their symptoms with their rehabilitation programme, and then they stop doing it because they're better, and then it comes back.
Yep.
So it is kind of a lifelong commitment, isn't it, to
Definitely.
keep your back healthy if you've had a back issue.
Definitely. I think that's part of our job as clinicians, is to educate people about that as well, because just as you said, Zoe, otherwise the back pain goes and everything goes out the window and they just get back to their old habits.
Thank you both so much. That was really great. As we've just discussed, rest is not always best, and when we've had pain, it is understandable that we might feel afraid to move and we can start overprotecting our back. But really, as the guys have said, movement is medicine. It's the most powerful tool that we have against pain, and that's not just preventing it but also treating it.